Good morning. I call this meeting to order and ask that you rise for a moment of silence and the Pledge of Allegiance. I pledge allegiance to
the flag of the United States of America, indivisible, with liberty and justice for all.
Alexis, you can call the roll.
Mrs. Reed?
Here.
Mrs. O'Connor?
Here.
Mrs. Rua?
Here.
Mr. Minio?
Here.
Ms. Doobie?
Here.
Mr. Bonavita?
Here.
And Mayor Sapelli.
Here.
7 present.
Thank you. We are resuming our meeting that was interrupted due to the storm on Tuesday, as you all know. And at the time of suspending the meeting, we were in the community as a whole discussing the 3 model options. Alexis, would you please read minutes back from new business where we were at the time moving forward?
Under new business, due to timeliness, on a motion made by Mr. Minio, second by Mr. Bonavita, the committee via roll call voted to suspend the rules to take action on SCR 2017, approval of plan for reopening of schools in September 2020. The vote was 7-0. During discussion, Mr. Sapelli explained that the committee was taking 2 votes regarding a plan to reopen schools. The first vote is to approve the 3 plans that must be submitted to the state by August 10th. The second vote will be to approve a specific plan with which the district will reopen schools in September 2020. Then, on a motion made by Mrs. O'Connor, second by Mrs. Rua, the committee via roll call voted to approve SCR 2017. Vote 7-0. Next, on a motion made by Mr. Bonavita, second by Mrs. Rua, the committee via roll call voted to go into committee as a whole in order to discuss which model to select for the reopening of schools. Vote 7-0. A lengthy discussion then took place. Mrs. Rua said she had toured some of the schools to see how classrooms would be set up maintaining social distancing. She began to share her experience when power was lost. Therefore, the meeting was suspended. There was a consensus of the committee to resume the meeting on Friday, August 7th at 9 a.m. The meeting will be virtual and live streamed on the Agawam Public Schools YouTube page. Time for 4:48 p.m.
Thank you, Alexis. I'll remind you, we are still in committee as a whole. We will have to have a motion and a second and a vote to come out of committee as a whole when we're done. And I want to remind you that we have Attorney Duperay and our health agent, Ms. Auer, on this as well. So at this point, we're going to pick up the meeting where we left off with Mrs. Rua explaining and discussing her experience at Daring School with the tour. Mrs. Rua.
Good morning. I know today is one of high emotions, and mine are high too. I don't think everyone knows I'm also a parent of 3 school-age children, one who will be a rising senior. So if I was voting today by my feelings, my wants, or my wishes, I'd send my children back to school, because I, like many of you, have struggled with the balance of working and having school be remote. But it won't be my feelings, but rather the facts and the many questions that have been left unanswered for me that are leading to me where I am right now. Safety and putting students first should be our number 1 priority. And to the community members writing to me and to all of us, I want you to know that oftentimes not all information is shared out, as there are many meetings and phone conversations, emails, discussions with leadership, discussions with principals, teachers, sort of fact gathering that happens off the radar that you don't see on this screen. And I've done my due diligence, and I continue to do my due diligence to obtain the facts and listen to everyone who's trying to reach out. So with that, I'm going to go back to tour day. And I was talking about how, as I was asked to go on this tour, and as I started to leave the house, I hesitated. I started to put myself in the mind of a teacher with the questions about what if someone around me is sick? What if someone around me is not wearing a mask? Is the headache I have right now just because I have a headache? Should I stay home, or is it something else? Maybe I'm sick. And all those what ifs that I realized the teachers would have to manage every day that they went to work brought me to the place to believe we need true answers and protocols in place so that we can reassure their concerns have been addressed before we can ask them to go back. At this time, I don't feel confident that I've been able to get the answers to all of those questions yet. So now to continue sort of chapter 2 of that story, I was in Deering, and all of the things that I've read became real. I saw the space where the teacher would stand in the front of the room 6 feet away. I saw how the desks would look. I saw where the students would sit. It wasn't a very hot day, and I was only there for under an hour, and I was completely uncomfortable. Yes, I do go out in the community. Yes, I go to several places and I wear a mask. Those places tend to be air conditioned. Those places tend to have pretty good ventilation. And what I was experiencing less than an hour had me ask again the questions. Anyone who's figured out by now I'm a question. I like questions. I ask questions, lots of questions. So I did have an opportunity to kind of leave the tour and ask a teacher who was standing at Deering a couple questions that I've had from students and parents. And the questions that were going through my mind at that time were, what if I was a student, maybe I'm thinking, what if the kid next to me isn't wearing a mask? What if I need help with my classwork and no one can come near me or sit next to me or help me? Maybe I don't feel well and the teacher can't come near me to stop me if I'm a little one and I'm crying. What if I can't sit still on that desk for 6 hours? What if I need a break and I want to turn around and talk to my friends? If I don't feel good? Again, all these what ifs isn't about the feelings. It's about trying to find the answers to those questions. And I don't feel like I have all the answers to those questions yet. So I'm going to just open the meeting by asking a series of questions that I have. I have about 8. So what is the number of COVID cases today in Agawam, please?
Mrs. Auer.
1 second, please. Okay, right now, as of this morning, we have 10 active cases. 5 are in the long-term care facilities and 5 are in the community.
Thank you, Mrs. Auer.
Thank you, Mrs. Auer. How many total cases have we had that are student age, under age 18?
Our statistics list the cases ages 0 to 19. We have had 7 cases since the beginning of the pandemic.
7?
Oh, I'm sorry, 12.
Okay.
I made it correct. 12 cases.
Thank you. So I guess to the district, one of the questions that keeps coming back up over and over again from teachers and from parents both, are we prepared to close there are COVID clusters, and what does that number have to look like? Because in the last meeting, Mrs. Auer said that it isn't if there are cases, but there will be cases. So in other words, what does that number have to look like to change course in any plan that we vote on?
And were you asking what the number has to look like before we change?
Yeah, are we prepared to close if there are COVID clusters, and what does that number have to look like?
We have
I cannot hear you, Mr. Sapelli, I'm sorry.
I think Ms. Auer has to mute.
All right, this is Mrs. Auer. Are you waiting for me to respond?
No, I'm waiting for you to mute.
If you're asking me what percentage of what numbers we would have to see in the school before we change the model, that has not been established. So I don't have an answer for that. The whole reason, again, I think I spoke to the other day for cohorting is that only the people in that child or staff member's cohort would be affected. So that is a decision that the school board or the district would have to make if several classrooms in the same school were home on quarantine, then they would have to look at the logistics of keeping that building open. But it may not be just a simple health factor, because if people are following the guidance and the cohorts are staying within their own group, following all of the social distancing, hand hygiene, not roaming around other parts of the building, then there may not be a health reason to close that building, but there may be other logistical reasons to close that building.
Thank you. Make sure, and when you are finished answering a question, to make sure you mute yourself so that we won't get that static background. Thank you.
Will there be a place that lives on the website that will say how many COVID cases we have in the school, so that parents will have that information on a daily basis?
We do not have that set up at this particular point in time. That is something we could obviously develop very quickly.
So for me, all those questions, and just that cluster of questions there, I do need answers on that before I can vote today, because without that, I'm not comfortable sending any child or teacher back into the building. I'll state that right now. Several parents asked if there will be temperature checks or COVID testing at the schools, and so I know the guidelines say we don't have to, but I can't even go to the hairdresser without getting my temperature taken. I feel like this might be about money. So why are we not doing random COVID testing or temperature checks at the door?
I can answer that. We actually have orders purchased for that reason, but it was also told to us, and Kathy maybe can more, a temperature or a fever is not indicative of somebody who might have.
Mrs. Hoffman, you're actually not coming through either very well. I'm not sure if we're hearing interference from someone else, but
could you mute your phone, please?
Thank you, Mrs. Howard. Kathy Howard, can you please maybe mute your phone?
Try it again, Sheila.
Hi. So is this better? Can you hear me now? Okay, great. So we did actually buy thermometers for temperature checks. However, it was brought to our attention by the medical field that temperature checks are not indicative of a possible COVID positive case, and that it would not be a helpful screening measure for us.
Thank you. I think it's going to be very difficult for even our nurses to figure out what to do with the kiddos that come in and have that fever. So that's why I'm asking the question. Parents are definitely asking. Can we go to the survey, please? The number 81%, that has been tossed around quite a bit. And so it was reported out previously that 81% of the families responded that they want to return to school under the guidelines. So if we could break that down, my understanding is that 3,700 students are in our district. 1,456 people responded. 1,168 responses said, bring us back. But Mrs. Hoffman, do we have data about who responded? For example, if the survey was answered more than once, could it have been both parents? Could it have been someone who wasn't even a parent? Because if we don't know where that data, can you answer that question, please?
I can, yes. We cannot verify any of the data in the survey. We do not know if people took it more than once. We can't verify if both parents of a family took it and are represented twice. That survey for us was to give us a pulse of the community at the time it was given or taken, to kind of see where people were where we were feeling. It is not scientific, and we cannot verify that data.
Thank you. That helps a lot, because I know that I've received, and I think I'm sure other committee members have received numerous emails from people saying that they did not, if they were asked that question right now, it would be a very different answer. And if they were asked that question right now, they would not have necessarily said they want to go back. So I definitely, that helps to understand that 81% does not mean 81% of our community is asking to go back. Not at all. Now another number, 78% of our teachers, it was said to us, want to return if there's 6 foot distancing. but I need to break that number down a little bit, please, Mrs. Hoffman. I read that 190 teachers wanted remote, is about 38%. 146 wanted hybrids, about 29%. 59% want all in, which is 12%. But I had several emails from teachers suggesting that even if they voted for that hybrid, they didn't have the option to explain that hybrid was acceptable, but only if they had conditions, knowing COVID numbers, or if they could have said a preference for how to reach that hybrid. So can you help break down that number a little bit more for us, please?
I can. So the data that you just spoke to about the teacher surveys, those actually came from two different surveys. One was given by the AEA, who were asked what model they would like to return in. The survey question that the district sent with the AEA support was that, are you comfortable with students at 6 feet? And it was a 1 to 5 range. And so the people who answered 3, 4, or 5 is what that 78% number that you mentioned. 78% of the teachers who took that survey, staff, let me just say, it was teachers, paras, secretaries, everybody. 78% answered 3, 4, or 5 that they're comfortable with students at 6 feet apart.
Okay, so that 78% means 78% would be comfortable with 6 foot. It's really a distancing question.
Correct.
Okay, that's helpful. So that means that 190, roughly 38% of teachers did ask for remote. So what is our plan, Mrs. Hoffman, for teacher absences or teachers that fall into high risk categories? So we're in phase 3 in Massachusetts, and it states on mass.gov, high risk should work from home if possible. So I did receive some pretty clear emails from teachers in that category who feel like they don't have an answer about that. So if we were to vote hybrid, what happens to them?
Mr. Dupre, is that something that you can weigh in on?
Yeah, I think the last meeting I touched on it a little bit. It was that we follow, there's a number of federal and state leave laws, like the Family Medical Leave Act, the Family First Coronavirus Leave Act. And then there's also the ADA, the Americans with Disabilities Act. So basically, one of two things would typically happen with teachers that can't return for medical reasons. Either they would get a leave, or we would try to accommodate. The third item could be an unpaid or a paid leave. And then there's also a category of people that if they couldn't return because they simply, felt like they couldn't return because they were afraid they might get COVID in the school environment, those individuals probably wouldn't have any protection under any of the statutes. And Mike Long, MASS's general counsel, sent out a pretty good breakdown of all of that, which I think you have, Sheila, probably.
I do.
Maybe that could be sent around to the committee, but basically it lays out all the protections for employees. And I know the unions have it already, so the staff would probably know that already as well. Or at least the union leadership would know it. I know the MTA knows it at least. Does that answer your question?
It's helpful. Thank you.
Okay.
So curriculum. So can we go to that one for me, please? Can you please discuss the time on learning in the remote? Again, we sort of touched on this versus the hybrid plans. The remote seems to guarantee individual instruction consistently. The hybrid seems to have gaps, learning interrupted on the home days of direct instruction. So what would happen to the special ed children, for instance? How would that look? It's very important to me that they have a consistency. So if we were to vote remote for the district, how would we improve how we reached out to our special ed children? And in the hybrid plan, I'm still incredibly confused with who's giving instruction on those 2 days. And it's feeling there's a lack of instruction and consistency for the AP classes in particular, for one example, in the hybrid model. So can you once again, please try to break down for me? And then I'll do the follow-up after. Let's start there, please. Thank you.
So let's start with special education in a remote setting. We actually are working with the Department of Education to see if we are in a remote setting, if we actually could have certain populations of students actually be in person. We don't have an answer, but we would like to suggest that if possible. And we also would like to be able to provide services both remotely and in person if we are in a remote setting.
That's very helpful. I know for me, I'm going to be more comfortable voting for any remote start if our IEP and special ed children can be considered in that. So that's a very helpful answer. Thank you.
Can I just clarify though? It would be certain populations. It would not be a student on an IEP.
Okay, but it's still helpful. It feels a little bit more hopeful than I did a few minutes ago. So under the 3 plans right now, if a student chooses remote learning, they're not guaranteed an AGOM teacher. Is that correct?
So
if we go hybrid, but then the parents get this survey and they opt to be remote, does that pool of students get an AGOM teacher or not?
On our Tuesday meeting, since our Tuesday's meeting, we have received additional information about what remote only choice, and that's kind of what we're calling it, the remote only choice could look like. We were looking at different options with partners from the state. That no longer is an option for us. We do not believe we'd be able to pick that. I think I spoke about the younger grades having an AGOM teacher, and maybe not the upper grades. At this point, after hours of work to develop a plan for remote only students, if we're in a hybrid or in-person model, we do think that all students who pick remote only will have AGOM teachers.
Okay, so that helps too. So that option is that's very good information for me. I would like the equity piece to be there for the AGOM students. I don't feel like someone who's immunocompromised or high risk should have the same opportunity.
If you're on a curriculum area now, if you could ask 1 or 2 more questions that relate to that so I can move on to someone else, and then we can come back to people that have more questions later so we can mix things up and have other people on the question.
No, that's fair. I said I had 8 and that was actually my number 8. So
you're good?
So I'm good for now.
Thank you.
Thank you.
Anyone else?
Are you asking if we have anything to say, Bill?
Yes, any questions? We're in committee as a whole for discussion purposes, so if you have any questions of the health agent, the attorney, the superintendent, now's the time.
So I don't have any questions, but I have some things that I'd like to say. I wrote some of them down. I really don't like reading them, but I wanted to collect all my thoughts. So as most of you know, making a decision about whether or not we have school in the fall is extremely complicated. And this is something I believe none of us have taken lightly. And members of the committee, whether we agree or not, have all worked very, very hard. I myself have received over 100 letters from parents, students, teachers, and paraprofessionals, and I've read every single one. I'm not an educator or a doctor. I'm an elected official here to advocate for the education of the children of Agawam and to serve as a representative of my community. I've done a lot of research, and my decisions are based on many factors. One is that the Center for Disease Control and the officials with the U.S. Department of Education, including the commissioner, has said that the guidelines they are imposing take into account the risks that the virus poses to children, and the evidence that remote learning can have a detrimental effect on children's education and their mental and emotional well-being. That came from the Department of Education and the Center for Disease Control. So we need to put children first, in my opinion, which we all know that. I think we're all on the same page when it comes to that. But when is it going to be safe enough to go to school? Is it going to be a vaccine? Is it going to be a cure? When we have 0 cases, what would happen to kids? What would have to happen for kids to go back to a normal setting? There isn't any answers, and there doesn't seem to be any end in sight. Here we are in August, and we're still in this pandemic. We never thought we would be here this late in the year. They've already missed 3 months of school. We can't prevent or control the risk. We can only try to manage it the best we can. We can't cancel school, as you can't get this time back. We're talking about our kids and their future. School is important to a child, not just academically, but it's important for their well-being, their language, communication, social skills, and in some cases, their safety. I know a lot of people have concerns about returning to the classroom and the recommended 3 to 6 feet by the World Health Organization. However, there are many occupations out there that require close proximity of other people. Police officers, those who work in retail, convenience stores, nail salons, doctor's offices, hairdressers, and restaurants work less than 6 feet of others wearing a mask. Most of us has been to one of those places. In restaurants, waiters and waitresses wait on people that aren't even wearing a mask. There's a lot of hypocrisy and they don't make sense. I might be alone in this, but I think children need full in-person learning, which I think can be done in a safe manner per the state guidance. The problem is, as we found out during our tours, and as Mrs. Ruiz pointed out, is space. After touring the schools, because of the state guidelines that we have to follow, space for certain activities such as lunch, passing time, busing, and arrival and departure times at some schools is almost undoable with all the kids in attendance, as Mr. Minio, I believe, stated at our last meeting. It would take a tremendous amount of creativity to make those activities be spaced 6 feet apart. The space guidelines make it next to impossible. So we visited the ECC, Robinson Park, the Deering School, and the high school. I found the space at the Deering School to be the most challenging. The principal of these schools are taking these guidelines very seriously, and I could see all the stress they are under trying to make it work in all 3 scenarios. I want to commend them for all their hard work and for their out-of-the-box thinking. Some of it was extremely creative, and I know some are working on their days off just to try to come up with a plan for each scenario. I want them to know that we appreciate their efforts. Because of the concerns of the teachers and the principals we spoke to today, who I have the utmost respect for, we have amazing teachers in Agawam. I would not be totally opposed to a temporary hybrid model which will allow for space for these activities with hopes that we can eventually phase into full person learning. With the hybrid, the children would at least be able to receive some kind of in-person learning, which I think is extremely important. However, I do think this would be a very difficult schedule for both the students and the parents. And if we decide on, if this is what we decide on, I'm hoping to provide some kind of creative support to the parents through the schools. I also think teachers would have to adapt to a very different way of teaching. We're very fortunate here in Agawam. There are 28,430 people that live here. As of this morning, as our health official said, we only had 10 cases, 5 of them are in long-term care facilities. That's a good sign. I want to let people know that I'm not insensitive to these safety concerns from some of our parents, our school employees, and especially the teachers. I lost a son to the influenza B virus, which was airborne from a cough or a sneeze when he was 2 months old. So believe me when I tell you, I understand your concerns. But I also think with the small number of cases we have in Agawam and using the appropriate precautions, students and staff can go back to school safely. It would be extremely detrimental for the children not to be in Agawam for another year. Regardless of what we decide tonight, not everyone's going to be happy, and none of it's going to be easy, as there are many, many details to work out. As everyone knows, things are changing every day, and whatever we vote on today could change by the time we get to September. We do have choices. Parents are not comfortable sending their kids back to school, can choose to keep their kids home for full remote learning, and as Mrs. Hoffman just said, they will get an Agawam teacher. I want to send a big thank you out to our school administration, their staff, our mayor, for literally working day and night to help get our children back to school or work out a plan so they can get some learning. I know Mrs. Hoffman is sending emails from early morning to very late at night, and I want her and her staff to know that I very much appreciate them. Thank you.
Thank you, Mrs. Reed. Anyone else interested to make any comments, ask any questions prior to coming to our committee as a whole?
I have something, Mr. Mayor, please.
Mr. Mayor, can you hear me?
Yeah, Ms. Doobie first and then Mr. Bonavita. Ms. Doobie.
Okay,
Thank
because
you.
Ms. Doobie first, then Mr. Bonavita. Ms. Doobie.
Thank you. I just want to say that my decision and how I am voting today did not come lightly. I've had sleepless nights, and I can count how many times I have reevaluated my thought process. With that said, I want to remind people of my role in the community. I am the director of a well-known preschool in town where I've spent the last 17 years of my 29 years as an early educator. I love my job. I take pride in knowing that all children will walk in and out of the doors of the school. I have a piece of the beginning part of their educational career. I can honestly say I do have children in the school system, and a lot of them. I was a big part in coming up with a reopening plan to get the preschool up and running again. On paper, it looked and seemed like it was going to be impossible, completely and utterly impossible to adhere to all the regulations set forth by our governing bodies. But we did it. We are open and running successfully, and the children are very happy and having fun. Parents dropped their kids off that first week with tears in their eyes and a big socially distanced mask wearing thank you. Part of the reason I ran for school committee was to be a part of their educational future and continue to try to provide them with excellent and equitable education in the Agawam school system. Another big part was to be able to be a voice for all the parents out there that need and want their voice heard. Never in a million years did any of us expect to make this huge, difficult decision. After touring the schools, most schools on Tuesday with the principals and Brian Pagella, the building maintenance director, I am confident that they do know what they're doing. I am confident in their plans and planned execution of such plans. I am voting today for in-person education. As an educator myself, I know the importance of in-person learning and how important it is for children to make that connection with their teachers. I heard the majority of the parents. I heard their voices. I heard their needs. I heard their desires. And I felt I had the duty to the community to prioritize three main groups that this affects. Number one, the children. What is best for all children and their educational and social emotional well-being? I heard, I listened, I investigated. They need school. They need in-person learning in a safe environment. And I'm confident we can provide that. Number two, the families and parents. What do families need? I heard, I listened, and I investigated. Parents need the children to go to school. They need to get back into the workforce and not to try to be something they are not, and that's teachers. As much as I commend all the parents and their efforts thus far in becoming teachers for their children, it wasn't easy. We appreciate you. It's time for your children to go back to school in person in a safe environment, and I know that we can provide that. Number three, the teachers. I believe with the safety measures set forth, teachers can do their jobs and do their jobs safely from their classrooms. I believe the teachers all want to get back to teaching your children. I do believe they miss their teacher life and can't wait to look into the eyes of your children and tell them, I am here for you. I believe in you. We are all in this together. And do this all safely with the guidance and safety measures in place. And I do believe we can provide that. It's quite obvious that people may feel nervous or afraid to go to school, but when are you going to stop being afraid? This is a virus, and viruses have been around for thousands of years. We can control it with safeguards, but we will never be able to totally eradicate it. That's my personal feeling. If wearing a mask and socially distancing prevents the spread significantly, and we can all agree we have a very low rate in this town, how much safer can we possibly be? Parents, I do believe it's up to you to talk to your children and tell them that this will be different. Things will look differently, and their rules are in place for safety for all. School will not be the same. It is going to be different, but together we can do this. Thank you very much.
Thank you, Ms. Dugan. Mr. Bonavita.
Yes, thank you. The reason why I was cutting in my other phone, for some reason you couldn't hear me in it. Something happened with the phone. So I'm calling in now on a house phone. I have about four comments to make.
Go ahead. Floor is yours.
Okay, thank you. I, first of all, I've studied this like everyone else has. I respect everybody else's opinion, and I respect the opinion of teachers, parents, anyone involved in this process. I think our superintendent has done an extreme amount of work, and it's a very difficult decision to make. So I broke it down to essentially 4 different areas. 1, what would I do if I was a teacher? If I was a middle-aged teacher right now, would I want to go back to school? Would I have fears about going back to school? Would I feel safe going back to school? At this point, I'd answer that no. And I've studied all the guidelines, and I've talked to teachers, and I've read all the letters from teachers and parents. Number two, I have a 3.5-year-old grandson who lives in Agawam, will be going to the Agawam schools in the future. I looked at it from his standpoint. If he were 6 or 7 years old, would I want to send him back to school? I thought about all the information that I've received. I looked at the guidelines. My answer was no. Now, third, I considered a medical issue. We have not heard from a doctor. We are not doctors. We have no right making medical decisions. In my opinion, the governor should have made a decision on this matter statewide. Instead, he didn't. He has the experts around him, and instead he gave it to us, local politicians without a medical background. I consulted people in the medical field. I talked to them. The resounding answer to the question of whether should we go back to school in a fashion of full in or 50-50 hybrid. The answer was a resounding no. Massachusetts is in an uptick. Some of the cities, not Agawam yet, are surging. They're beginning to surge. That's probably the correct language. That scares me. It scares the governor. The governor had a big article in the paper. He released numbers. NECN did a report on the surging cities and on the actual numbers. Now, what I am confused on is the numbers that I've been hearing. With all due respect to everybody involved, I've heard different numbers earlier. I heard different numbers now. I looked at the NECN report. They cite 19 cases in Agawam in the last 14 days. They cite 25 cases in Agawam positive in the last 14 days. Now, I know our health director says she gets the information, but my concern is where are all these numbers coming from? How can these reports be issued and be totally wrong statewide? So I am confused about the numbers. I don't trust the numbers. Now, whether it's numbers in the medical field, whether it's the survey, I don't trust the numbers. So I have to use my own common sense. I went to people in the medical field so I could obtain their information. The resounding answer was no. Now, I have taken this very seriously. And yes, the superintendent asked, how do we sleep last night? I didn't sleep very well. The last week for me has been a very stressful situation. Thinking about people's lives are in my hand. Someone with no medical background, now all of a sudden, I'm supposed to make a decision on their future livelihood. Whether they go live, get sick, need rehab, or die. And first of all, I don't think we should be making this decision. Second of all, this morning, if I have to vote, my conscience, and I have thought very seriously about the hybrid model, the 50-50. If there was a plan that would delay the hybrid, totally delay the hybrid and we could start with remote, I might consider it. There is no such plan. So therefore, I have no choice to vote for remote. And that's the way my votes will be taken on all three questions with that in mind. I respect your opinion. We may differ, but I ask you to respect mine because I haven't made this decision lightly. This has been extremely difficult. And I wish everybody well in making this decision because I know the amount of stress you're under. Thank you very much.
Thank you, Mr. Bonavita.
Thank you, Mr. Mayor. This is Carrie O'Connor.
Ms. O'Connor, go ahead. You have the
Thank
floor.
you very much. Again, I want to thank you. I want to thank parents, the teachers, administration, school committee for your hard work and efforts planning for reopening of schools. And yes, we all have worked. Yes, this has been a decision that has been forced upon us from our government. And yes, none of us are medical trained professionals. However, we are here to make a decision of the lives of our children, parents, and the community, and teachers and school staff. I know what it's like to struggle as being a single parent with minimal work hours and the financial hardship and burden that this pandemic has placed on my own family. I have a 15-year-old son who's in special education and know firsthand about social emotional needs of our students, as well as I do work with several families. Firsthand experience since this pandemic regarding the regression of our students, as well as the mental health needs of our families due to the economic hardships and many families have faced, including depression, including multiple hospitalizations, working with families and students who have had inpatient hospitalizations. I have firsthand seen what it's like, firsthand, in a particular situation where there was a 15-year-old student in another school district who had lost her whole family and was wiped out by this disease. And this individual had to relocate to another state because all her families were wiped out. I know firsthand what it's like delivering lunches to families. There are 5 family members in one household who have contracted this virus. I do know what it's like for families to have to lose a loved one by providing emotional support to those family members, to be there on the phone for support through this pandemic. Now we take numbers. I have a script here and I really have a difficult time following it, but I'm speaking from my heart and I'm speaking from what's in the best interest of our students, our teachers, and our community. My son is in special education, and that is confidential information that I am bringing out. I am a certified educational advocate and have advocated for many students in many different school districts, as well as an active consultant in many school districts. I have seen what it's like firsthand in other school districts regarding what the impact of our setting. Our schools have been completely transformed for our students. I have seen this firsthand. I have witnessed this firsthand. I have witnessed the emotional impact of hardships that our families have gone through financially, depression, and not knowing what they're going to do, what tomorrow brings. I, as a parent with this background, as well as being a veteran and traveling to many countries and seeing many different hardships in other countries and parts of the world, that we are very fortunate to have the education system that we have in this country. I am aware within the Department of Public Health reporting system that 7,357 children from the ages of 19 and under for the whole state of Massachusetts have had positive COVID cases. 7,357 children across the Commonwealth. And this is data that is reported directly from the Department of Public Health reporting system that anybody could pull this up on mass.gov publicly. 7,357 children. Out of those 7,357 children, how many families have been impacted, and also how many other family members have contracted this virus throughout the Commonwealth? The active case count through the Department of Public Health reporting system is 19 cases. The last 14 days, there are a total of 20 positive tests in Agawam. 25. And I would like to ask our health inspector as to why that data is not being reported. There has been a 2.42% positive percentage increase directly reported from the state reporting database. Mrs. R., do you agree with these numbers?
Mrs. Zauer, are you with us? I know you were having some technical difficulty with your phone line. If she can jump in, she will. Miss O'Connor, I can tell you this in my conversations with both she and Sherry Petrucci, the town nurse, that those numbers I would suspect are accurate over that period you gave. What people need to remember is as time goes on, each day, people get added or deleted based on their care, being tested in or out. So over 14 days, I'm sure there were 25. I'm sure that number is probably accurate or close to it. There are some delays, as we found out from talking with Mrs. Auer, with regard to data being recorded. But people do come on and come off on a daily basis. What we do know is right now today, she checked this morning, there are 10, 5 are in the long care facilities, 5 are in the community. Were there probably or possibly 25 over the 14-day period? I'm sure there might have been. But remember, people come off and come on that list on a daily basis.
Great.
I can speak to that.
Thank you, Mr. Mayor, for your opinions on that matter. Governor Baker expands. Also, there was a data reporting of a 2.42% increase in the town of Agawam. As to, in my opinion, as to why the Governor Baker expanded, quote, hotspot testing in 8 more communities. Free testing will be made available to anyone in Agawam. Brockton, Methuen, Randolph, Revere, Springfield, Taunton, and Worcester. Agawam was one of the communities that the Governor Baker's administration has targeted for Agawam to have hotspot testing. That is documented. It is online. Anybody has any questions about that? The data is documented, and that has been fact-checked. The 8 communities were selected because cases and positive test rates far exceed the statewide average, and the volume of testing being conducted has declined in Agawam. That, to me, in my opinion, is the reason why Agawam has been a targeted hotspot community to have Tapestry Health here to have testing. I have listened to many opinions within the community regarding Agawam being at low percentages, which I understand those opinions. However, the data shows that the state of Mass is increasing with positive cases, and not only Massachusetts, the nation as a whole. There have been many questions regarding those parents who want their children in school and parents who want their children at home as well. I have listened, I have read multiple emails, spoken to many people within the community regarding different opinions. I would rather overreact than that is what I would do. I'd rather overreact than underreact. There's a lot that is taken from this. With that said, my priority is to ensure the safety and well-being of our students, teachers, school staff, administrators, parents, and the community. The hybrid plan, there are a lot of questions that there are a lot of teachers that have asked. There are questions, many, many questions that have been unanswered. One of my other concerns is that our local government offices we are all here virtually, and we expect our children to be going into school. While us as school committee members, our role is to represent our constituents in the community. And what example does this set for our community? Us as parents are our children's role models. We set the tone for our children. We support our children. We ensure that our children are safe, no matter what the circumstance is. We adapt to transitions. Our tone, we mentor our children, parents and teachers. The tone that we set in our families and our children will trickle down to our children. We embrace our children. We nurture our children. We love our children. We ensure that our children's needs are being met, including social and emotional needs and physical needs. It is our role as a parent and as a community, as a school community, to ensure that our children are safe. If families are struggling with the pandemic, as I had to utilize resources and know what it's like firsthand, in making a decision regarding my son also having regression because of social emotional needs, and working with many families in the community to see the impact this has on families. I have direct experience. If families are struggling, there's mental health agencies that could provide therapeutic support to our children if they're struggling with regression. There are networks of multiple behavioral health agencies to put resources in homes to work directly with parents and children to assist with their social emotional development. The school's hands are tied. Jesse, our commissioner and the governor set these guidelines. Every school district across the Commonwealth has had to create these guidelines to the best of their ability. And then the decision falls on the school committee. I agree that we have not heard from a physician which the district does contract with a physician. And we have not heard. We have had transition task force put into place where there was multiple meetings that I also had participated in. That multiple discussions with that transition task force were not carried forward to the current planning that is current in place that has been proposed. There are many unanswered questions. It's not easy for anyone. And no one ever expected that we would have a pandemic and or were prepared for this pandemic. No matter what the decision is today, our children will be educated. Our children will be educated. And we have dedicated and passionate teachers, counselors, school staff, administrators to support all, no matter what model is voted on today. With students who have additional needs, related and special education and or accommodations will occur for those students who have those individual needs. If parents are concerned about their social and emotional well-being of their children, then it is a parent's responsibility to ensure that they will take every avenue that they can take to make sure that their child's social emotional needs are met. Yes, school's responsibility to teach our children. It is a school's responsibility to support our children in having and developing social emotional needs. And it is the parent's responsibility to parent our children and be there for our children and help our children. It is a parent's responsibility to save our children. With that said, I do not feel comfortable sending my child to school with the needs that he has, based on the plans that have been put forward by the hard work of the administration and the dedication of all that were involved in this planning process. There's a lot of unanswered questions. For example, we have a teacher that comes into the building who is sick, right? Passes that along to another teacher, then they go home. And that teacher who is sick goes home, and then another family member contracts it, and then another family member. This is the impact of this virus. Because we do have a 2.42% increase, does not mean that the increase will continue. It is better to overreact than underreact and save our children's lives and save our teachers' lives. So with that, my vote would be complete remote today.
Thank you very much. I know Attorney Dupre, you have to jump off the call very shortly. Are there any other questions for Attorney Dupre before he jumps off the call? He has another call he has to get on at 10 o'clock.
Mr. Mayor, I do have a question as far as, can we put in a motion to look at potentially...
Ms. O'Connor, is this a question for Attorney Dupre? I want to get him off the call. Okay, hold on.
Is on.
Okay, thank you, everybody.
Is on.
Thank you, Ron.
Thank you very much.
Negotiations.
Okay, we are still in committee as a whole. Concerns, questions, comments?
Mr. Spelly?
Go ahead, Mr. Minio.
How you doing? I had a question for Sheila. If we did adopt, and I think I asked it it was addressed at the last, but I just want to make sure everybody watching, maybe, some people couldn't get to the last one. If we do adapt a hybrid model, we do have the ability to pivot both forward and backward, correct?
That's correct.
Okay. And are you anticipating getting some sort of, because, my concern with the hybrid is that there's no specific metrics in regards to what would pivot forward or backward. So I think if we do adopt a hybrid model, there should be some sort of scenario which would have us reevaluate it. I am under the impression that at any time, though, you do have the ability to stop school if there was an outbreak. Is that correct?
That is correct, and we would go remote if that were the case.
Okay. I wanted to thank Cheryl, the whole administration, for all they have done. The building principals, it was evident when you walk through the amount of stress and pressure that they are under, not knowing, one, what model we're going to go to, and two, how to prepare for, a unique scenario that no one thought we would be in. I also want to echo what some other committees members said. One is this should not be a school committee decision. We are not health experts. The fact that they have passed the buck down because they did not want to make a decision is sort of why we're in the place that we are at. With that being said, I think the best learning environment for a child is in school in front of a teacher. Now, obviously, based on the state requirements, and when we toured the school, that was evident that it would be near impossible at a 3 feet distance based on the desks, based on drop off, based on pickup, based on eating, at a 6 feet distance. But like I said, my vote today is going to be in favor of a hybrid model. I know it does not solve everyone's problems. I know that there's still going to be a childcare issue for the parents that do work. I know that, teachers, who totally have done everything they can, last year through the remote model, it happened. It was, no one expected that transition. And if we do go to remote, I am confident that it's going to be a different remote than it was last year. But I think that at a 6 foot distance, children can go back to school safely and get instruction from a teacher. Now, I was very pleased to hear, Sheila, that you said that if a child does choose remote, because that is an option, that they will get taught by an Agawam teacher, because I was struggling with that tidbit, with a hybrid vote, knowing that they would not be taught by an Agawam teacher. So I'm very happy to hear that piece of it. I want to thank all the school committee members for all their hard work, all the parents for their emails, teachers for their emails, the surveys. This is a decision that's not taken lightly. I have gone back and forth over the last few weeks on what the right decision is, and I can only make the decision that I think is right for myself to make. So I understand the viewpoints on everybody's opinion, but that's where I'm at. Which is a hybrid vote. But if there was to be an outbreak or any scenario, the ability to pivot to a remote, or if things moved in the right direction, which hopefully sooner than later they will, we would get all the children in front of a classroom when it's safe for everyone. So that's all I really want to say. Thank you guys for everything.
Thank you, Mr. Minio. I think basically we've hashed this out under committee as a whole. So
Mr. Mayor, I'd like to come back if I can, because I asked my questions, but I cut myself off from making my sort of statement of where I stand right now. So can we please come back?
The floor is yours.
Thank you. So I woke up today and the first email I saw said, Agawam student dies of coronavirus. That was just the header of an email meant to obviously get my attention, but it also begged me to do my job. You elected us to do our job. Nothing we are going to do today will be easy. Doing what is right, is not easy. Might not even be popular. As I said in the beginning, my own house, my vote affects my rising senior. I won't be popular in my own home. I agree with things that have been said about the governor or commissioner. They should have made this decision for us. They didn't. They knew that they couldn't make all sides happy. They kicked it to us. But I don't feel that we're ready to be in school at this point. I've also heard, I've listened, and I've investigated. I've read over 350 emails. And I respect my colleagues. I know you've done the same work. And I also thank the admin. They've been absolutely responsive to every question we've asked them. I've had no sleep. I'm in all of those categories everybody talked about. But my issue and why I'm stuck is we keep getting different numbers and different answers to the most important category of safety. I can't vote for anything but a remote start if I don't have the answers to those questions, and I keep getting different numbers every time I ask. In the last week or so around town, we all heard sort of this and that, but I listened to firsthand accounts from my friends of what it was like to listen to their teenager say and get a letter that said, you need to quarantine. And that teenager say, did I just take something home to my mom, to my dad, to my sister? We really want to talk about the social emotional impact. Something like that stays in my mind. What is that doing to the mind of that student? And that could happen on a daily basis when we put those kids into school without having these questions answered. A pediatrician wrote to us and said, the global scientific community simply does not have enough data on COVID-19 in children to predict what effect allowing children to congregate in a modified school setting would have on the disease burden in children, teachers, and their respective families. Children have been relatively isolated since the start of the pandemic. So data with regards to COVID-19 transmission, virulence, etc. in children has been limited so far and is still evolving. There have been some studies showing that children transmit the virus less often than adults do. However, children are more likely to not show any symptoms, which affects the accuracy of viral transmission and data. So that's from an Agawam resident who wrote to us, who happens to be a pediatrician. Safety first. I haven't heard the metrics that will be available to families to make daily decisions to send or not send their child to school. We don't have metrics being shared with us to how we're going to change course, so I'm uncomfortable. For these reasons, I will be casting a vote for remote. Like I said in the beginning, it's not based on feelings. If it was, I'd be voting to give my oldest his senior year and to put my other kids in school. This is a very personal and very difficult vote for me. Mr. Mayor, I want one last question, please. Can we present to have a vote for a hybrid model with a remote start? Is that possible?
No, that would be a remote start.
Okay, thank you.
We have to pick either remote or hybrid or all in.
Well, I would go for a remote start to answer some of these questions and take our time to more thoughtfully, similar to what Mr. Bonavita talked about, a window of 30, 45 days, and then moving into a second category of getting the kids in the building and getting these group of students what we all want them to have. I would entertain that, but only with a remote start to give us time to thoughtfully have all these questions answered before we move into that.
I understand exactly what you're saying, and it's my understanding that what the reason for voting for 3 different models was that the state wants us to pick one of those 3 models to start. They don't give us a timeline of how long you're in it. They just want to know which one you're going to start with, whether it's a week.
Well, I think that's interesting only because other communities have come out with their plans where they voted remote to phase in, and they've clearly put out their calendars as to what that looks like in their local communities that are pretty close to where we live. So I know it can be done. I think it's just maybe don't want it to be done.
It certainly can be done, but once again, that vote would have to be to vote to go back remote.
Excuse me, Mr. Mayor, if I may interject.
Go ahead.
It's Mr. Bonavita. I read the 3 plans. I saw nothing there that said you could not do a combination of plans. So the question is, can we vote for 50-50 with a remote start? And I don't care what the governor categorizes it at, whether it's a 50-50 phased in or it's a remote start. It's the same plan. We have to be safe. And right now, from what I'm hearing from medical people, and what I'm hearing about throughout the country is that this virus has evolved. That's why it's called a virus. How many times have we gotten flu shots and been told, you got the wrong strain, that's why you're sick? So until they develop a vaccine, children are going to be high carriers of this disease. They may walk around asymptomatic, and I'm getting this information from things that are being reported around the country. When this virus first started, it was widely believed it was going to affect senior citizens, which I am one of. Then it went to middle-aged people. Then after Memorial Day, it hit 30 to 40-year-olds. After that, there were reports of teenagers. And there's now even been reports of babies. This virus is trying to kill us. It's trying to find a way in any person of any age's body. And we, as a country, do not have a handle on it. We are not close to having a vaccine. People say the first of the year. People said election day. I mean, it's getting to the point of being ridiculous. So as far as I'm concerned, I would support a remote plan for only 30 days and then a phased in 50-50 plan. And since we're having to make this enormous decision that we're not qualified to make, I would like to come back every phase of the plan that our superintendent has developed. Right after remote ends, we should come back and decide whether to go to the first phase of the superintendent's plan. Then we should come back before the second phase of our plan and vote to go to the second phase and the third. If I'm going to get blamed by some portion of the community for not being sensitive to their needs, I want to be able to cast a vote before we go from one phase to another. And I want to start remote because I don't believe that this country, this state, or this community has a handle on this virus. We are all guessing. And if people die because we guess, we will never be able to sleep at night. So that's what I'm asking for. I am strictly asking for a very sensible position that is start off remote, then transition by school committee vote to the first phase, the same for the second, and same for the third. I want children back in school, but I want them back in school where we can at least be to some percentage of certainty that they are safe. And to say that right now that we can do that, I don't believe is accurate. We know we've had teenagers in this district, this school district, that have contracted the virus. Even our health director substantiated that. So how can we sit here and say that there aren't going to be teenage kids going to our high school or younger children who will send that virus to a teacher or another student who will take it home to their parents and their grandparents and their uncles and aunts? Once it hits and gets out of control, we will all be crying. And I believe the sensible position is to start out remote. Now, I originally thought, and I still believe, that we can call our plan a phased-in 50-50 started by remote. So I disagree that we have to say, oh, we're remote. We can start with a phased-in plan. And it could be called a phased-in plan, even though it starts with a 30-day remote.
Thank you.
And honestly, money
to the state, and she knows what they're looking for better than any of us do. Sheila, would you address that
Sure.
question?
And I agree with you to some extent, Mr. Bonavita. We can call it whatever we want. But when I submit how we are going to start the school year, I have to choose remote, hybrid, full in. So we can devise a plan that does exactly what you're saying. Start remote with an intent to go hybrid at a certain date to be looked at. But again, a remote start of that plan means that we are starting remote.
Okay. So here's what I'm going to do based on your information, and I appreciate it. If we get to a vote on hybrid, I will make a motion to amend that vote to include a 30-day remote start. How you characterize it for the state?
Yeah, that'll make sense, Mr.
Deal.
So why don't we wait until we get to that point? If and when it even comes out hybrid, we don't know. It may come out remote. It may come out all in. When it gets to that point, whatever plan it is, anyone can make an amendment or an adjustment to whatever plan we vote on to try to accommodate everyone's needs. As long as they get the majority vote of the committee, that'll be the end plan.
I appreciate that, and I thank you.
Thank you. Any other comments, questions, concerns before we come out of committee as a whole? I just want to thank all of you. This isn't easy. It takes a lot of thought, a lot of pressure. We don't have answers. There's very many unanswered questions, but guess what? There's always going to be. We aren't going to have all the answers. And unfortunately, as all of you have pointed out at one point or another, this is a decision that it was selected by us that we would make, not a scientist or a medical individual or a governor, but us. And now we have to take all the information we have, our experiences, personal and otherwise, and make the best decision we can based on safety first, what's best for kids, and what staff, teachers, parents prefer. But in that order, safety, what's best for kids, and so on. I do know that Dr. Kerouac, who is the president and CEO of Bay State Medical Hospital yesterday, in the newspaper made a statement with regard to getting back to school. And he thought it was important that kids get back to school with all the safeguards and following the guidance. I know CDC is recommending that students get back to school with all the safeguards and all the precautions, skipping none, as well as DESE. This is not going to be an easy decision for any of us. The fact that we're not always agreeing on all of these things, and you can see that from the discussion today, that's healthy. Because if everybody always agrees, somebody's not thinking. So I think that's a good point here. So at this point,
Mr. Mayor, can I just respond, please, to what you just said about Mr. Kerouac? Because I read that same article, and in that same article, he also said, it worries me a lot that we might be starting to see a resurgence of cases in our area, which is quite alarming. I'm worried that we are entering a perilous new phase of this pandemic. So there are a lot of other things said in that article, and those are the things that I listened to when I read it.
Oh, I read all of it as well, but the bottom line is he in favor of kids going back to school or not, with precautions? And yes, we all are worried about what we don't know, the unknowns, and he said that. But he did say, following all the guidelines, he is recommending trying to get kids back to school. Before I have asked for a motion to come out of committee as a whole, did you have a comment or question? Are you all set, Mrs. Hoffman?
I'm all set, thank you.
Is there a motion to come out of committee as a whole?
So moved.
Mr. Bonavita made the motion to come out of committee. Seconded by Ms. O'Connor, is that correct?
No, Mrs. Rua.
Mrs. Rua, thank you. Any questions or discussions further on this, coming out of committee as a whole?
No.
Alexis, would you call the roll, please?
Mrs. Reed?
Yes.
Mrs. O'Connor?
Yes.
Mrs. Rule?
Yes.
Mr. Minio?
Yes.
Ms. Doobie?
Yes.
Mr. Bonavita?
Yes.
Mayor Sapelli?
Yes.
With 7, we're out of committee as a whole.
Thank you. We're out of committee as a whole. Now, we are at the point where we want to have a motion brought up by anyone with regard to one of these specific models that you are making a motion to approve. Is there a motion by anyone to approve any one of the 3 models, a remote, hybrid, or the all-in?
Mr. Mayor, I make a motion to go all in. Please. Mr. Mayor, I make a motion for all in education, please.
Ms. Doobie's making a motion for all in. Is there any seconds on that motion?
I'll second it.
Okay, we have a motion made by Ms. Doobie, a second by Mrs. Reed. Any questions or discussion? Alexis, would you call the roll? Do it alphabetically.
Oh, okay. Mr. Bonavita?
No.
Ms. Doobie?
Yes.
Mr. Minio?
No.
Ms. O'Connor?
No.
Mrs. Reed?
Yes.
Mrs. Rua?
No.
Mayor Sapelli?
No.
Okay, with 5 no and 2 yes, it does not pass.
Okay, it does not pass for all in at a 5 against, 2 in favor of. Is there a motion for one of the other 2 models?
I'd like to make a motion for the hybrid phased model that the superintendent presented. If I want to make an amendment, do I make that now?
After the motion
After the motion is passed.
Okay, so I'd like to make a motion to adopt a hybrid phase plan for the reopening in September 2020 as the superintendent presented.
I'll second it.
Motion made by Mr. Minio for the hybrid as recommended by the superintendent, seconded by Mrs. Reed.
So do I understand, Mr. Mayor, that you instruct us that if that motion passes, it then can be made a motion for an amendment, or it has to be made now?
First, you take the
I always thought you made the motion for the amendment first. You would vote on that. If the amendment was defeated, then you would vote for the exact motion that was made. If it was allowed, then you would vote on that whole motion.
Correct, because you can't, once you vote a motion to go forward, you couldn't come back and make an amendment after the fact.
Okay, so I'm gonna redo it then. I'd like to make an motion to adopt the hybrid phase plan for reopening of the schools in September 2020 as the superintendent recommended, with a trigger to be reevaluated for pivoting based on Governor Baker changing phases and steps in conjunction with state guidelines.
Second.
I would like to make to amend.
Hold on, Mr. Bonavita. Mr. Minio's making a motion to accept the hybrid recommendation, but adding into that, amending it to state that we will pivot forward or backward, contingent on the governor progressing forward or backward with the phases. Is that correct, Mr. Minio?
Phases and steps.
Phases and steps, either pivoting forward and or backward, depending on the governor's movement with stages and steps.
In conjunction with state guidelines.
In conjunction with state guidelines. Mrs. Reed had a second to that motion.
I now make a motion to amend. I would like to start with 30-day remote and then phase into the plan that Mr. Minio has just.
Mr. Bonavita, that would be a motion to go remote. We're voting right now on a hybrid.
Disagree, Mr. Mayor. You and I have a disagreement on that. It's still going to be considered a 50-50 phased-in plan. How the superintendent categorizes it for sending it into Boston is up to her.
I'd like to say I disagree also in that 30 days could be written into that phased-in approach that Mr. Minio just spoke about.
I also disagree. Can we have discussion?
That's what we're doing, right? We can't have discussion until we have a motion and a second. So we have
Shelley seconded it.
Motion and a second, and that passes, we're done. So that's why I think we're talking about that.
Hold on.
Yeah.
Stay organized. Mr. Minio made a motion that's on the floor right now, an amended version of the superintendent's original submitted recommendation. We had a second from Mrs. Reed. Now, discussion.
Yes. I have a couple
I
of
made a
questions.
motion to amend. Go ahead.
Okay, so what Mr. Minio is suggesting is that for the hybrid model, what I'm looking at this, I may be a little bit confused, but I'm looking at this a little bit backwards. I know we're talking about the hybrid model right now. Both start. So basically, if that hybrid model, it would be presented as a hybrid model, and what we're asking is for an amendment for a time frame, having a remote start. Now, however, I want to, maybe this is not the time to discuss it until another motion is made. However, I would be in agreement with a remote start, phase in hybrid, versus hybrid with a remote start. I believe that I will work as hard as I need to work to ensure that our students are being educated and working together in transparency across the board. That 30-day approach, I believe that it should be contingent upon the numbers and the data that's presented with Agawam and across the state. I think 30 days, I think we as a committee as a whole would need to pull together weekly or bi-weekly or however often we need to reassess the planning. So therefore, I would make an motion, I don't know, maybe I can do it now, to start remote to a phased-in hybrid. Vote on remote, but amend the plan to have a phase-in hybrid approach.
I thought I made the motion.
Mr. Bonavita had the option of doing that first. Mr. Bonavita, you want to add an amendment to the motion by Mr. Minio, seconded by Mrs. Reed, about a hybrid, and you want to make a motion to adjust that. Go ahead, Mr. Bonavita, again, one line. Then we'll
Similar,
discuss it.
Ms. O'Connor was talking about, Mrs. O'Connor, that start with a 30-day remote, come back and reassess, consider what the governor's recommendation still is,
Yes.
and reassess and then vote to go to the first phase of 50-50.
And I
And then go
second,
to,
basically amending Carm's amendment.
Yep.
Okay, let me just call on Attorney Dupre, who just was able to join us. His other call ended. He came back with us. I don't know if you're aware of that. Attorney Dupre, what we're doing here is we had a motion made and seconded to adopt a hybrid model that the superintendent recommended with some caveats that Mr. Minio put in. That was a motion that was made and seconded. Then Mr. Bonavita wants to add an amendment to that amendment. Are we following the proper procedure? Because this is an important vote. I just want to hear your legal opinion on that.
Mr. Minio's motion was not an amendment. It was a motion. He was amending the plan, but that's still his motion.
Correct.
So he made.
Correct. He made a motion, and it was to amend the original plan, but he made a motion. You're amending his motion.
That's correct.
Thank you.
Well,
Attorney Dupre.
So Mr. Minio's motion to amend the first motion was seconded and voted?
No, we didn't take any votes. And Mr. Minio's motion was not to, he made the original motion.
Oh, okay.
He
The
wants,
original motion was hybrid.
Excuse me, point of clarification.
go ahead.
Mr. Minio made a motion. His was not an amended.
Correct,
He didn't amend anything.
correct.
Superintendent has a plan. He took her plan, he put it into a motion the way he wanted it formatted. That's not an amended motion. That's a motion.
Correct.
I motion to amend.
So did Mr. Minio's motion get seconded?
Yes.
It did?
Yeah.
Okay.
Yeah.
My motion.
And Mr. Bonavita, during discussion, wanted to make an amendment to Mr. Minio's motion.
Was there a second on that?
Not yet.
Not yet. What is the amendment?
Go ahead,
The
Mr.
amendment is to start with a 30-day remote period, then to reassess and to phase in to the superintendent's plan.
And there is
The same-
a second, I have seconded that.
And our question, Attorney Dupre, is that if Mr. Minio made a motion for hybrid and that amendment calls for starting remote, is that allowed?
Well, you're really more than amending, you're changing the motion.
Right.
Correct.
That's a different motion.
That was my concern.
Well, then I agree with Mr. Dupre. If that's the case, you mean to tell me that whoever rushed to get their motion in first, that carries the day? And you don't even
No, I
get
mean,
to
that
vote on
motion-
remote?
That motion could be, if the belief of the committee is that they want a remote start, then they should vote no on Mr. Minio's motion. I mean, the other option is, so his motion would fail if there's a majority that doesn't want that approach, knowing that secondary approach is out there. And then another motion would be made. Now, I will say Robert's Rules of Order aren't a law, so it's a procedural method of handling meetings. So
Yes, but I was taught. Excuse me. I was always taught, point of order, that the motion's made, and I've done this many, many times, and you make a motion, somebody makes a motion to amend, that a motion to amend is voted on first. And then if that passes, there's a vote on a motion with the amendment. If it doesn't pass, you vote on the actual motion, the original motion.
That's
Excuse me.
Hold on. Attorney Cooper has the floor.
That's true, but what I'm saying is normally an amendment is not something that completely changes the underlying motion. So your options as a committee, the ones that almost all schools have looked at, are either hybrid, remote start going into hybrid, or full in. So those are three options. There's other options too, but those are three. So your amendment is really not, it's another option. Now, in my opinion, it's irrelevant which one goes first, because if the committee chooses to vote on Attorney Bonavita's motion instead, and that fails, then you would go back to the hybrid motion. If you vote on Mr. Minio's motion first and it fails, then you go to Attorney Bonavita's motion. Either way, the results, in my opinion, would be the same, because you either want remote to start or you want hybrid to start of those two motions. So I don't see the outcome being any different regardless of which one you vote first.
Oh, yeah. To me, the outcome is different because we'll never get to a remote vote. Well, you're asking, this is a remote with a phased-in hybrid.
Yeah, but that's
So
remote. I mean, it's
hybrid passes.
That's how they all.
We're never going to get.
You would if his motion fails. It means people want remote with a phase-in. So you would get to a majority that doesn't want hybrid.
I think my amendment gets put on first. Am I correct?
Legally, Robert's Rules of Order does not actually bind you. What I'm saying with that, Robert's Rules of Order are it's a procedural method to run meetings. It's not a law. So, in my opinion, this is not a amendment, though. It would be considered an unfriendly amendment because it's actually a different motion completely. You're not amending his is hybrid to start. Yours is remote to start with a hybrid function later. That's really the other plan.
Well, I put it on the record that I think that is incorrect, and it makes whatever vote we take illegal. Robert's Rules of Order has been followed since it ever started. Okay, and I've been doing this 16 years. I did it 4 years on the council. And you always vote on the amendment first, according to Robert's Rules of Order. If we're not going to use Robert's Rules of Order,
I have an
then
idea
what
here.
order are we using?
Mr. Bonavita, an idea that'll address this. Mr. Minio, would you like to remove your motion at this point in time?
Yeah, I'll remove the motion.
Now,
I think that's the easiest thing to do myself, because
for another plan, remote or hybrid?
I move for a remote plan
Okay,
with a hybrid.
is there a second on Mr. Bonavita's motion?
Second, but Mr. Bonavita, can I clarify, please, when you say remote, do you mean 30 calendar days or school days?
Yes, I'm sorry, we've talked about it so much that I gave the short version. I asked for a 30-day remote start, then go to a phased-in plan. It's a 3-phase plan to 50-50.
But Mr. Bonavita, 30 calendar days or 30 school days? I just want to be clear, please.
Oh, 30, I'm talking about 30 school days.
Can I ask a question?
I would second that.
Okay, we have Mr. Bonavita with a motion, and we have a second from Mr. Grua. Questions or discussions? I would like to Superintendent Williams, you had a question?
Yes, I guess because we've talked about a couple of different options for the school, starting the school year this year. And right now our approved date is August 31st for teachers and the 3rd for students. Are you talking from that date?
From whatever the first day of school is.
Okay, however that is adjusted. Okay, thank you. That's important. We're bringing that in. And Mrs. Brewer, I think, was up. Did you have something, Mr. Brewer, first? And we'll keep going. I know there's other questions.
No, again, I want to be real clear with that start date, Mr. Bonavita, if you meant 30 days from the teacher's first day, 30 calendar day. I just want to be really clear on what your 30 days are.
No, from the first day of school where students begin the school year.
Mrs. Brewer, is your question answered? So I can move on. Ms. Ruby.
Yes, thank you.
I'm just wondering where the 30-day plays in. I mean, what gives us the authority to pick how many dates? It's just
I didn't understand that question, please. You're asking me a question?
No, it's actually just a comment. I just don't understand where the 30 days comes into play. Is that supposed to, you know, I just...
Well, I'm going to answer your question. I believe that it'll give us a chance to reassess what's going on in Massachusetts. Is it really an uptick? Are cities really starting to surge? What are the numbers in 30 days? Now, we know we've had young people, teenagers, exposed. We don't know if they've all been tested. We don't know what the results of their tests is. As a matter of fact, if the 14 days quarantine that they could possibly get it in has not even gone by. And so at this time, I want to be very safe and start off with a 30-day remote period from the first day of school, just to give us a chance to see what's going on across our state. I understand what's going on in Georgia and Florida and California. But frankly, I am talking about Massachusetts. And I know we have a few weeks till we even get to when school starts. So I think a 30-day period from the first day of school is reasonable.
Thank you.
30 school days would probably bring us close to November, Sheila, I would assume. So if we're doing 30 school days.
If we're using the September 3rd date, it's October 13th. 15th, sorry.
I have a question.
Hold on, let her finish answering the question. September 14th or 16th date, when would it be?
Yeah, so Cheryl's looking at that now. I just want to remind people that we are we are looking to add more teacher planning days to the school year before the start, so that September 3rd could move to the last day being September 16th. And if that's the case, 30 school days after that is
October 26th.
October 26th.
Any other questions?
Question, please, to the chair.
Go ahead, Mrs. Reed.
So Mrs. Hoffman, in the hybrid plan that Carmino had introduced, that was assuming we start on September 16th, correct? Could you go over what you, can you go over the plan that you proposed when we at the last meeting, please?
Yes, the hybrid plan that I proposed starts school on September 16th, which again is the last day that we are allowed with the relaxation of the 180 school days reduced to 170. And on that day, pre-K through 5 and 7, grades pre-K through 5 and grade 7 would start in the hybrid mode. The remaining grades would start remotely. On the 24th of September, 6th grade and 8th grade would start in the hybrid mode. The reasoning behind that again was 5th and 7th graders are new to their schools this year. So they would, and I'm sorry, ninth grade was included in that. 6th, 8th, and 9th grade are new to their schools. So they would be in school as a grade level by themselves for a week before adding the third phase, which would start October 1st with all students pre-K through 12, hybrid mode. Hybrid mode.
Does that answer your question, Mrs. Reed?
Yes, so I would be in favor of the plan that Mr. Minio made a motion for and what.
Yeah, right now on the floor, we have a motion by
I know, I'm just,
Mr. for remote. We are sticking with the motion on the floor for remote that was seconded. That's what our discussion should be limited to at this time, please.
so I would not be in favor of remote start.
Thank you. Any other questions or discussions on
Yeah.
Mr. Bonifaci's motion? Mr.
Yes, I have a question. Okay, so Sheila, when does the first marking period end for our students?
I don't know off the top of my head, and that's gonna have to be adjusted based on the start date.
Right, if the start date is September 15th, can you do a projection of the first marking period, please?
December 1.
I would say probably end of November to beginning of December. And I do want to state that we have secondary schools that go on 4 terms, and our elementary schools go on 3 terms.
I understand that.
Okay.
My concern is, I think this motion, I am for this motion for remote start. However, I think the 30 days, for me, the 30-day remote, I think that if we put that time frame on, I think that cause barriers. And what I mean by that is, if there's a way to reassess this without, if we put, say we put 30 days, 60 days, or until at least the first marking period of a projection marking period, that at any given time, we as a district school committee will come back and reassess as needed and come back to the table. Because I think that 30 days, I strongly believe that it's not enough time. I think that's
a very valid point, the time of this, so I want to ask Attorney Dupre. Attorney Dupre, once we decide on a plan and a start date, does it go back to committee to change that, or does the superintendent change that independent of school committee? How does that work?
In my opinion, a superintendent would have the authority under an emergency to change the plan immediately, like a snow day would happen. So let's say we saw an outbreak and it was clear, the superintendent could immediately go to remote and then subsequently get a vote from the committee. But in normal circumstances where there isn't some type of emergency trigger, I would say the committee would need to vote with input from the superintendent, obviously.
Thank you.
Mr. Dupre, I'm a little confused about your answer. Can you please clarify? Is there any documentation supporting your answer regarding the first part of your answer? If there is an emergency, of course, the superintendent would have that authority, but can you please clarify that for the record?
So in my opinion, I'm not saying there's a state law to that effect, but when there's a fire or there's a flood in the building or there's a weather emergency, superintendent makes the call without any input from the committee. So we're
talking about positive cases, COVID. We're talking about,
Yeah, so let's say, I don't think it's probably not overly likely to happen, but what I've been telling superintendents and committees throughout the state is if the superintendent walks in school one day and the board of health director calls and says, by the way, we have, 20 new cases in the student body, and she's not going to wait for a school committee vote. She's going to make a decision right then and there, which I think is in the best interest of kids. So
absolutely.
So that's really all it is. I don't think it's
talking about where this phased in. We're really talking about at this point, you know, I understand the emergency. We have to make that call immediately.
Yeah.
I'm talking about when we are currently talking about a phased in and you know, as to whether or not the committee is able to work with administration, you know, as far as if we take the 30 days off the table and we reassess, say, every 2 weeks or every 3 weeks.
Yeah, that's up to the committee to decide if you want to do it that way. You want to put in a date trigger. I was only giving you the two ways it would happen. One is the superintendent in an emergency. Two would be the committee if you're voting with some type of process or phased in approach, either with dates or just every meeting you have, you relook at it. You know, that would be up to you.
Okay, thank you.
You're welcome.
Any other discussion on the motion by Mr. Bonavita, seconded by Mrs. Rua on starting remote? Any other discussion?
Yes, can I just interject?
Go ahead.
After a lot of thought and consideration, I trust the superintendent that if there's a flare-up during the year when we're in the stages, that she will come back to us. She will talk to the committee. I don't think it has to be in the vote. I trust her judgment on that issue.
Thank you. Any other discussion on the motion that's on the floor for remote?
Yes, to the chair. Just want to say I just want to clarify that this is a vote for a remote start, correct?
Correct.
Thank you.
Any other questions, discussion? Seeing none, Alexis, would you please call the roll?
Mr. Bonavita?
Yes.
Ms. Doobie?
No.
Mr. Minio?
No.
Mrs. O'Connor?
Yes.
Mrs. Reed?
Sorry, no.
Mrs. Rua?
Yes.
And Mayor Sapelli?
No.
With 4 no and 3 yes, the motion fails.
Okay, the motion to start remote has failed. Is there a motion, Mr. Minio? I know you had a motion. I don't know if you want to resubmit that, or is there any other motion to go hybrid, which is our third option?
So I'll make that motion again. So I would like to make a motion to adopt a hybrid phase plan for reopening schools in September 2020 as the superintendent recommended, with a trigger to be reevaluated for pivoting based on Governor Baker changing phases and steps in conjunction with state guidelines.
And I'll second it.
Motion made by Mr. Minio, seconded by Mrs. Reed. Questions or discussions on the motion on the floor, please?
I have one for Mrs. Hoffman. You mentioned that in that model, you were bringing in the children that were new to each grade level a little bit more slowly. How about our kindergartners? How does that work? They're all in on the same day for a beginning.
That's a good question. I had them coming in with the added planning time that we're hopefully giving teachers. I have them starting the hybrid model on the 16th, according to that plan.
Right, so all in, but a little different from the other ones who are transitioning to new schools.
Correct.
The new kindergartners are all in day one, the 50%.
Correct. Hybrid, right.
Any other questions, comments, concerns?
Bonavita, please.
Mr. Bonavita, you have the floor.
I disagree with this plan. I want to put it on the record. I don't think it protects teachers. It doesn't protect students, only because it does not have a remote start. I believe with what's going on across the state, the statistics we're receiving, they're reported in both government websites and NACN, and from the governor, there was an uptick in cases, and there are some cities that are actually surging, which have begun. So to sit here and act like everything's going to be wonderful is a mistake. And I will not vote for this plan only because it's not sensitive to our teachers, our students, and grandparents, and all their uncles and aunts, and the entire community. Thank you.
Thank you. Yeah. Mr. Dupre. Hold on, Attorney Dupre.
Yeah, I just want to add something that I know the commissioner wants you to give a decision by, I think he moved it to the 14th. What I would say is you're making a decision now with several weeks left to go. So whichever way you vote, you and administration should continue to look at the cases. And if things change dramatically one way or the other before the school year starts, I would say we look at it. I know the commissioner wants a decision by a certain date, but if you have a dramatic change, either up or down, there's nothing, in my opinion, that should stop you as a committee from making decisions about what is right or wrong. So, and I've also been telling other committees that this is not, he wants a decision by now. Parents need a decision about what's going to happen. But that said, if there was something dramatic that happened one way or the other in the figures, there's no reason you should turn a blind eye to it and not consider it. So although it feels like you're locking yourself in stone right now, I would say, you know, if things change dramatically in the next 4 or 5 weeks, you know, I would say meet again and talk it over again. For now, you're basically setting a plan based on what you know now. And unless things change dramatically, it probably will be the plan to start the year. But if there's a major change, I would imagine superintendents throughout the state would be pushing the governor and the commissioner to allow them to modify the plan if needed.
I agree. I think that's why Mr. Minio in his motion had that pivot criteria in there. Ms. O'Connor, you had a statement or comment you wanted to make. Ms. O'Connor, you have the floor.
Yes, thank you very much, Mr. Mayor. Hybrid model. Here are some questions. Again, what are the dates that the kindergartners are going to be starting?
So the date I had proposed is September 16th.
Okay. Regarding the hybrid model, is there and this is just for discussion right now. Again, is there an opportunity to still submit the hybrid model to the state, but amend the hybrid model to have a remote start?
No, it's a remote start. Then that's a remote start, which we already voted down.
That was the remote plan that we voted down. I'm not talking about the remote plan, Mr. Mayor. I'm talking about a remote start for the hybrid plan as part of the plan created by the administration.
Mr. Attorney Dupre, would you give the technical answer to that, which I believe is there are 3 options: remote, hybrid, or all in, and that would be considered a remote, or am I wrong?
Yeah, I think, Carrie, I'd need more explanation about why you believe that's a different motion than the one made by Attorney Bonavita, because his was remote start, phase into hybrid.
Right, that was for the remote plan. And I'm looking at the hybrid model with a remote start within the hybrid model.
Well, Attorney Bonavita's would have been the hybrid model. You can't have hybrid with remote start. It's remote start was the previous motion, and then you slide into hybrid. See, I'm not saying
hybrid model, is there a possibility to extend the date within the hybrid model for a remote start?
So just a couple of points to make. The start date really is still up in the air. We still have to work with the AEA on negotiating any new start date. So that was just my proposed start date. And again, the commissioner has relaxed the 180 days in school that we have to attend to 170 with the September 16th day being the very last day you could start school this year at this time.
Our concern, though, is not the start date at this point. It will be. Right now, our concern is what model are we going to open up our school year with?
So Carrie, to further up on this, the commissioner wants to see on day one of actual kids in school, are you remote, hybrid, full in? And so the vote is really, so your vote, in my opinion, would be the same as Attorney Bonavides, because on day one, you'd be remote.
I understand that. I'm just asking questions. I think that this is also, again, I think that has been a lot of all of these plans. I will stand my ground, and the safety of our students, our staff, and community come first. And that's the bottom line. I do not agree with this plan starting off.
Thank you. Any other comments, questions, concerns?
Yeah, just one brief one, please.
Go ahead, Mr. Bonavita.
I wish Mr. Dupre had made the statement that he made about the always coming back in 2 weeks before we voted on the remote, because it works both ways. If we voted in my motion or my amendment, or no, it was a motion. We changed it. It was a motion. Thing could cut the other way. Things went wonderful in the next 2.5 weeks, and our cases stood where they were or went down. And if the state felt they were doing better based on the governor's information, we could have changed it to start the phase in earlier. But Mr. Dupre did not raise that until after we took the vote on the remote.
Mr. Attorney Dupre.
Yeah, I raised it because of specific concerns that were brought up on this vote. So, but I would also say if you start remote, what the commissioner has said is that you can't have high school fall sports, and you also may lose the CARES Act money. So it's not always easy to go from remote to hybrid. Also, I think you'd have union issues. If you vote remote and then you change your mind later, I think that'd be much more difficult to move back from. Where going from hybrid to remote is something that I don't think you would get union pushback on, and you wouldn't lose the CARES Act money, and you wouldn't have the sports issue. So if somebody asked me a question on the first motion, I would have answered with all of that then, but it didn't come up.
Through the chair, can I ask a question?
I may
Mrs. Reed.
respond to Mr.
Mrs. Hoffman, if the hybrid does pass, the parents have, they can choose remote if they feel that that's what they want for their children. Is that correct?
Correct. Mr. Bonavita.
Yes, if I may. Parents may be able to pick remote. The teachers can't. They still have to withstand whatever is in front of them, of all those issues. And as far as money goes, I have thought about that. I understand that the federal government, Mr. Trump, has threatened to take away federal money, and I'm not trading lives for $2 million. And as far as sports is concerned, we received an email from the superintendent yesterday that said there has not been a decision by the MIAA or by anybody to take sports away at this point if you start remote.
That is accurate.
Mr. Mayor, can I please?
Yes, Mrs. Lewis.
Thank you. I hear we're voting on this hybrid plan, but it does clearly state that there's a remote start for, in particular, some of our grade levels. So I'm still confused with this language. Why, if we can vote for this, we can allow for a remote start for half of our population.
So I guess the difference here is some of our students will be in the hybrid mode on the first day of school. And
Well, wouldn't everybody be on the hybrid mode? Just some start different days.
Because that's my confusion, Ms. Dibby, because we have remote start for about half the grades with this particular plan. So is that still voting remote for half of them, but hybrid for the other half? Mr. Dupre, can you help figure that out?
That's what a hybrid is, I believe. The remote start is going to be for all those families also that choose remote start over hybrid.
No. In the plan Mrs. Hoffman presented, it says there's a remote start for grade 6 to 12 and a remote start for grade, is it 8 and 5? I'm not. So there's a remote start for half of the students in our district that we're just voting on in this plan. Half of them start remotely. So how is that different? How are we voting hybrid? I'm very confused, Mr. Dupre.
I think that's a question for Sheila, really.
So the difference is not all of our students are starting remote. Some of our students are starting in the hybrid mode on the first day of school.
Could I go back to the question, Sheila? So the last I heard from the commissioner's office is they were saying you couldn't do sports in the fall. Has that changed?
It was said that there's a possibility.
Okay.
So the reasoning being, if communities feel it's not safe to go back into schools, then they probably also feel it's not safe to put students in sports activities. We did receive an email from the MIAA saying that at this point, there is no policy that if a student isn't in the buildings, that they can't participate in sports. Okay. So that was yesterday, I believe, afternoon.
So just to clarify something, I'm just trying to give you, answer your questions, give you the information. I mean, how you vote is up to you as a committee. I'm not trying to take a position one way or the other. That's not my role at all. If you ask me a question, I'll answer it with the information I have. But whether you go hybrid or remote or full in, that's every committee's determination. You are elected to do that. So I'm not attempting to weigh in on that. I'm just answering questions as they come up. So if you have any other questions, certainly ask me, but it's not, I'm not trying to influence you. I'm just giving you what I've been told from the commissioner and other bodies.
Thank you. I hear you. I'm still a little confused on just the wording on how we're voting on all of this. And I just want to go on record one more time and say that because the questions haven't been answered, because there hasn't been transparency, in my opinion, numbers have changed almost on a daily basis. Answers are changing and are not available for people to really make this vote at this time. I will be voting no on this. I think it's unsafe. We're not ready. And I'm really disappointed right now in where we're at, more so than I've ever been in 9 years on this committee.
Thank you, Ms. Dora.
Yes, I have a couple more questions. I have one question for Attorney Dupre. Mayor, Attorney Dupre, when you talk about losing, right, with the CARES Act and the HEROES Act coming forward, do you have accurate data? Not your opinion, but what are we looking at?
The only thing I'm aware of with the CARES Act, and I think Sheila would have heard this directly, is from what I've been told from superintendents, is that the commissioner made a comment that a remote start would have an effect on your CARES Act funding. Is that accurate, Sheila? That's what I've been told, at least.
So I'm going to say again, the comment was made, it could have an effect. It was not
okay.
Either way.
Okay.
Yeah.
I just wanted to clarify that for the record.
Thank you.
Yeah, I don't think anybody's speaking in definitives. This has been, I think it, I don't know if it's politics or what it is, but those are the things. I'm just trying to make you aware of that as a potential out there because it's important to know at least. But.
No, it's important. I understand for the community and absolutely, I am all for funding for schools. I do have to piggyback Mr. Bonavita that, there's no amount of funding for me to save a life. And again, I think there's a lot of unanswered questions in this hybrid plan. There are, again, I think the administration has done to the best of their ability. There are a lot of unanswered questions. And, the transparency. I'm also very disappointed that there has been a lack of transparency going on, between administration and the school committee members and just school committee and the community and the parents. There's been misinformation, misrepresentation within the community by our local officials. And I also believe that my priority is in the best interest of our students, our teachers, and our community. And this should not be a political issue. Period. So I'm disappointed in this plan. Again, my opinion is by reading many emails with the parents, teachers, talking various phone calls, safety comes first. Our children will be educated. And if any one of you have experienced this firsthand, you may have thought differently. But I truly believe no matter what, and going, with how I disagree with this, again, safety comes first, and that's the bottom line.
Thank you. Alexis, would you call the roll, please, on the motion made by Mr. Minio, seconded by Mrs. Reed, hybrid model?
This is a hybrid model. Mr. Bonavita,
No.
Ms. Stube,
Yes.
Mr. Minio,
Yes.
Mrs. O'Connor,
No.
Mrs. Reed,
Yes.
Mrs. Rua,
No.
Mayor Sapelli.
Yes.
With 4 yes and 3 no, the motion passes.
With 4 yes, 3 no, the motion to go with the hybrid model passes. Thank you. Thank you, everyone, for your thoughtful input. We will submit the hybrid model to the state by August 10th deadline. Next, we have any other items that may legally come before the committee. And we will start with Mr. Bonavita.
No.
Ms. Stube.
No, thank you.
Mr. Minio.
Nothing.
Ms. O'Connor.
No.
Mrs. Reed.
No, I think everything's been said. Thank you.
Mrs. Rua.
So many thoughts, but I'll be putting them out in a different form and another time, not on this. I will be putting out a statement in a different way. Thank you.
Thank you very much. Thank you for all your inputs on this particular issue, which was a very, very difficult one. With that, the chair will entertain a motion to adjourn.
So moved.
Second.
Motion made by, seconded by Mr. Minio. Alexis, please call the roll.
Mr. Bonavita,
No.
Ms. Stube,
Yes.
Mr. Minio,
Yes.
Ms. O'Connor,
Yes.
Mrs. Reed,
Yes.
Mrs. Rua,
Yes.
Mayor Sapelli.
Yes.
With 6 yes and 1 no, we are adjourned.
Thank you. We are now adjourned at 11:09. Thank you.
Thank you.
Bye, everybody.
Hello?